Hey, Doc.
Hi, Miranda.
It's Tuesday.
It's Tuesday. What a good day. How are you?
I'm doing good.
Good. Come on in here. What's up?
Sweet.
I thought today we could talk about inflammation.
Okay.
Okay? Because inflammation is present in just about every patient that we see who has like a myriad of different health conditions. First, let's start with like the obvious. If someone has pain, let's say back pain, neck pain, one of the more common reasons that someone comes into our office, those areas that have pain, they're almost certainly going to have some inflammation in the joints, inflammation in the tissues. There might be inflammation like close to the nerves, and inflammation is one of the biggest drivers of pain and of decreased range of motion, because where there's inflammation, there's usually going to be some kind of swelling, and that's going to limit mobility in the joints. So one of the things that we're always talking to our patients about is how can they heal? Okay, what are the strategies that they can use, not just coming in to see us for adjustments, but what can they do to get out of pain and get their body to function better, to get them back to their normal or even better than where they were before. So part of that is let's treat the inflammation too, and treat the adjustments, and the things that I do here in the office are really helpful for that, but they have to do other things outside the office too. Maybe they need to use ice. Maybe they need to avoid like putting a hot pack on an acutely inflamed area. Instead, use ice instead, because that helps. Certainly just refraining from things that make the inflammation worse. So yeah, you're not going to be able to golf for a week or two if you've got a bad low back injury, because every time you swing the golf club, you're just going to re-exacerbate the injury.
Mm-hmm.
Those are the more like common, like bread and butter chiropractic pain, joint pain, inflammation things. But then there's also inflammation elsewhere in the body, and one thing we're learning from like current research on health and longevity is inflammation is one of the biggest drivers of a lot of diseases, whether it's diabetes, digestion issues, even Alzheimer's. There's a component with dementia to having inflammation in the body and inflammation in the brain. So a lot of our patients come to us with other concerns too, of like, how can I stay healthier longer, and what can I do to help be as healthy as I need to be? So then I'll help them with that as well. We'll put them on a nutritional regimen where they're doing like an anti-inflammatory diet that reduces the inflammation in the body. And once they start doing that, not only do they feel a lot better from their adjustments, but things like digestion improve, the immune system functions better when you don't have as much inflammation in the body. They tend to just feel a lot better. Certainly other environmental factors can go into inflammation too. So other toxins in the area, toxins in their food supply, maybe they're not drinking the kind of fluids they need to drink, and they're too inflamed from that. One of the things we'll talk about too, if someone's worried about inflammation, is supplements and vitamins that they can take. So a good example is someone who wants to take turmeric or curcumin for inflammation. That's a great way to help with inflammation in the whole body, whether it's in the digestive tract or in the skin or in the joints. So when someone has pain or any other like health issue going on, something we try to burrow into is like, what is happening as far as your body's inflammatory response, and how is the body able to like process inflammation in a healthy way, or are there obstacles that could be removed so that the inflammation's less in the body and they function the way they're supposed to function?
Well, that's great advice.
Yeah, thanks, Miranda.
Thanks, Doc.
Mm-hmm.